right. I think I'll go ahead and get started. I know folks are still joining, but good morning, good afternoon, good evening. Thank you all for joining us. So this is Dimagi's first ever Impact Delivery Community Gathering and live Ask Me Anything session. If you haven't already, take a moment, say hello in the chat, share where you're calling in from. And again, welcome you to have on video if you like or not, either way. So I'm Amy Vaccaro. I run marketing at Dimagi, and I'm going to be your host for today. And we have a very special guest with us, Erin Quinn, who is Dimagi's Senior Director of Customer Success. Erin has spent the last decade working with hundreds of INGOs and local organizations to build and scale sustainable long-term technology platforms for impact. Her expertise in transforming unique scenarios and needs into actionable digital strategies has made her highly sought after by our partners. And today, Erin's going to be sharing her insights and answering your most pressing questions in the field of impact delivery. So welcome, Erin. Do you want to say hello?
Yeah, hi, Amy. Thanks so much. And I see a few fellow Washington, D.C. folks calling in. That's where I'm based out of for today. So thank you guys all for taking this hour and joining us. I see some familiar names too of folks I've worked with before. So it's great to be here and really excited to hear all the questions that you guys have.
Awesome. Welcome, Erin. Thank you for being here. So before we dive into questions, I want to acknowledge that we had a really incredible response to this session. We actually had a couple hundred registrations, and many folks included questions in their registrations, which was awesome. So we got almost 100 questions from each of you. We've got attendees from all over the world, from a range of incredible organizations, including World Vision, CRS, International Rescue Committee, One Acre Fund, World Food Program, CordAid, Mercy Corps Care, Save the Children, Pathfinder, and many, many more. So really incredible to see the response. I imagine folks will kind of keep joining in as we go. We had so many questions, so we definitely won't get to every single question just based on time constraints. I want to make sure we can have good conversations around each of the questions. But what we've done is we've distilled down a diverse range of questions that represent a lot of the different topics that came up in your questions. And if there's unanswered questions at the end, we can kind of take them forward into a future AMA or also do follow up after this session one-on-one with folks from Dimagi. So definitely keep your questions in mind. And at the very end of the session, we'll have a poll where you can kind of share if you have lingering questions to make sure that we're able to capture those. And if you are on and your question gets asked, we may ask you to come off mute and share any responses or any feedback or follow-up questions. And as you saw when you came in, we are recording this session. So we'll be publishing this to YouTube and other social platforms so that you can review again and others can see it. So without further ado, I think we can go ahead and get started. So, Erin, the first question that came in, and this came from actually two different folks, Tabiso as well as Humberto. The question was, what should I consider when assessing various digital tools to digitize a program?
Yeah, that's a fantastic question and a great first question to kick off with. So yay, you've made the decision to use a digital tool for your project. That's really exciting. I'm glad that someone in your organization has decided that that's the right path. But then you have the even tougher task of figuring out what is correct for your organization. And I think there are lots of different things to take into consideration here. Where I would actually start is, what is the user need? What are you hoping to accomplish by using digital in your project? And not only what are you, as maybe someone who's working in a country office or an HQ office, hoping to achieve, but what is everyone else in that system hoping to achieve too? So think about, how could a tool help transform my frontline workers or my data collectors' jobs? How could it help people at kind of the local office, the country office, the HQ office? Think about all those things that would make their job better, and then build your requirements out from there. So some of the things we like to look at are, is there case management? Does it work offline? Those are all sorts of things that are going to really help your frontline workers. What sorts of things does the platform allow for that are going to help make a frontline worker's job easier? Those are big wins for those frontline workers. So look at all sorts of features that can support that sort of work. For folks who are kind of in like the country office or local office, we oftentimes want to look at data and reports. How easy is it going to be to take data out of the system, How easy is it to do really simple analyses and also really complex ones? Because we probably have to do both of those. There's probably something you want to be looking at on a weekly basis just to understand at a high level how your project is doing. And then maybe for something like annual reporting or global indicator reporting, you need to do something much more robust. So what are your requirements, and what are you going to require your tool to do? That's really good to kind of lay out. What do you need to see in terms of like supervision? Obviously, if you have 1,000 enumerators out in the field, you want some ability to supervise them. So what are your supervision needs? How are you going to actually monitor what people are doing? And does the tool provide that out of the box, or are you going to have to, configure something in order to do that supervision? And lastly, you want to think about who are the data consumers going to be, kind of that top level that's not really going to interact with the system very much at all, but is going to want to see the data really nicely out of there. So looking at things like, what is it? What can it connect to? What sort of interoperability options do you have? Can you really easily connect to other tools within your tech stack? So if you're a Microsoft shop and you guys only use Power BI, how easy is it going to be for you to connect this tool to Power BI? Similarly, if you throw everything into a SQL database, how easy is it going to be to connect to that? So you want to look at what would make everyone's jobs easier, build your requirements out from that. And then, of course, you also just want to see how well does it fit in with the rest of our tech stack. You want to make sure that you're not reinventing the wheel. Bringing this one digital tool in does not mean that now you have to get 5 other licenses for 5 other types of software to be able to operate within that. So look at what is the objective best tool for you, like for your needs, wanting to collect data and do service delivery with this tool, but then also something that's going to fit really nicely in and complement the other tools that your team is already using. Because I promise you, if you come in with a new digital tool that requires people to learn 5 other new tools, no one will do it, right? So I would say those would be like the broad considerations. The other one, of course, cost. Like we all work with budgets, we all work in international development. Cost is a huge one. And look at cost in a longitudinal way. So look at not only the price, but what does that price include? Are you going to have to pay more as you scale? Could you scale basically for free? What is the cost based on? Is it based on number of users? Is it based on number of applications? Is it based on form submissions? So try to really do some math of what that cost is going to be for you. And then look at scalability. Is this a tool that might serve you really well right now, but in 2 or 3 years, if you scale, it's going to not work for you anymore? That's probably not a good tool to choose unless you really are committed to like, this is just a really quick 3-month baseline, and then I'm going to tackle this bigger issue later. But right now I'm just doing a quick Band-Aid sort of solution. In general, we don't want to be doing the sort of quick Band-Aid sort of solutions. So you want to see, yeah, can I scale with it? If my project does really well with it, can I bring like 10 other projects onto it? What happens if, maybe I'm working in Kenya? What if Uganda decides that they want to use this tool too? How does that work? Would there be economies of scale when we use this, when we're looking at cost? Would there be kind of like some really great peer-to-peer learning that could happen if we all start using this tool? So I think those are all kind of the concerns and things that I would want to lay out. And if I were someone that was trying to make this digital tool, what I would do is I'd actually go to every single user. I'd ask them what they want from the tool, and I'd ask them their concerns about getting a new potential tool. I think you have to be ready to answer every single one of those questions so that invariably when you get it, you feel really secure and really confident.
I think the 2 folks that had asked this question, I don't see them on, but in case anyone has any follow-up questions to that, feel free to come off mute and chime in now. And also, as Erin's speaking, if you want to kind of probe on something she's saying, feel free to raise your hand as well, and I can bring you in. So there was one kind of related question. This was from Rachel, which is, what's key to getting stakeholders to start systematically using digital dashboards to monitor and adapt their programming?
Yeah, that is such a key question, right? Because there's nothing sadder to me as like a technology specialist than seeing an amazing app, amazing data that no one is using, right? So you, as the person in charge of kind of the technical portion of it, could be doing your job perfectly. And if no one is using that data, kind of like, what's the point, right? And this is a really big cultural shift. It is not at all a small task to say, like, how do I inculcate a culture of us continuously looking at data. And I think it's really up to the managers to make this something that is just a built-in part of every meeting, every day, every week. So one of the things that I do in CommCare, at least, and I think in a lot of tools, you can get reports sent to you on a scheduled basis. So my first 5 years at Dimagi, I worked in the field. And so I would go and I'd be sitting in someone's office. I'd be like, great, when is your weekly meeting? Thursdays? Great. Thursday at 8 a.m., you're going to get these 3 reports emailed to you. You're going to look at them. And in your 10 a.m. meeting, we're all going to talk about them. So one, see what sort of like technical things you can do to make this easier. It's always easier to get a report in your inbox. So one, what can you automate to kind of make this more top of mind for you? And then 2, whoever is controlling these weekly, monthly check-ins or meetings, it's really up to them to start off every meeting looking at that data. And that's what I would do is I'd say, the first 5 or 10 minutes of our weekly meeting, we're looking at these 3 reports. We're seeing if everything looks good. If it looks good, great. Like, let's just move on and we can go talk about the rest of the agenda. If something looks too good, let's investigate that. If something is looking concerning, let's look into that too. And so I think really building that into the sorts of meetings you have, the sorts of pre-existing events like that is a really good way of making it something always that's top of mind. And another thing I'll say is let's set some benchmarks right now so we know when we should raise our red flag. So if you say that every mobile worker is supposed to do 30 home visits a month, what starts to look concerning to you? Do we raise that red flag at 20 home visits a month? Do we raise it at 10? Do we raise it at 0? Kind of set those thresholds for what is concerning to you so that every week, every month, as you're looking at that data, you can be like, this is officially something that we should worry about. And also, again, at the beginning of your project, before anything has started, what would be the sort of actions that you could take? What would be the repercussions of finding out something in that data? So in our example, if you need to do 30 home visits a month, maybe if it's end of the month and someone has only done 15, we say that's our red flag. And then what's the action? The action might be I reach out to that person's supervisor and I try to understand what's going on. But as much as you can chart out both your thresholds and the associated actions early on, the easier it's going to be when you actually have the data. Because of course, once you start implementing, there's a million things going on, right? So you don't want to have to be creating these processes when you're in the middle of like 15,000 other implementation tasks. So yeah, I think doing a lot of pre-planning in the beginning, setting those targets, setting those actions, and then really inculcating this culture of continuously looking at your data and continuously looking at what needs to be fixed, what can we change. I think that's really how you do it. And it's honestly, it's a lot of hard work that takes commitment from you and your team every single day and every single week. So it is a very huge cultural shift, and it's absolutely one that's worth putting the time and effort into.
Yeah, absolutely. Thank you so much for that, Erin. And I see there was one question in the chat that maybe is a bit of a follow-up to kind of the first question on considerations for digital tools, which is really asking around, how do you think about cost effectiveness of deploying your tool, especially in low-income settings?
One thing I'll say as someone who's worked on the tech end of this for 10 years, although I worked in international development before I came to technology, is that somehow we have like these $5 million projects floating around, and then all of a sudden, like $1,000 or $2,000 a month is too expensive for your digital tool. And that's always something that's been really perplexing to me, because if a digital tool is the crux of your project, how are you telling me $12,000 a year is not manageable? But I think that this is a problem kind of endemic to the way that we build our budgets, that people don't want to invest a lot in software. I would say one study that I love is one that I believe was done by Mathematica on a CRS project, and it looked at cost effectiveness of a maternal and child health app in Uttar Pradesh, India. And it found that it was specifically about CommCare, but these studies exist for other tools as well, which is that using their application was as cost effective as several vaccines. And I think that was a randomized control trial. So that's a great piece of evidence to say this isn't just Erin from Dimagi saying, yeah, they're really great. It's like an actual piece of research. But I think the other thing that we do is we really talk about the cost of these things on like a per user, per beneficiary basis. If a phone is $300 and you've got a software plan that's $1,000, but it's supporting 500 workers, like $2 a user a month is nothing if that user is following up with, 200 kids every month. So I think the way I approach this a lot of times is really kind of doing the math on that, doing the total cost of ownership, saying this is not a big portion of your budget. This is very much worth it. It's worth $2 a month to give your frontline workers a tool that's really going to transform the way that they do their work.
Yeah, no, thank you. Thank you for that, Erin. And I think this is actually a good place to sort of speak to this concept of impact delivery that is in the title of this event, right? Which is really about our approach as Dimagi of kind of shifting from a world where digital tools and development are really just about extracting data and mining for data, and that they're actually about delivering impact over the long term. And I think the things that we think about and that we see as like really critical to success long term for these programs is that you're able to see digital and use it both to deliver services as well as collect the data you need, right? And actually primarily creating these tools as job aids, right, to support the service delivery. And they're so useful that frontline workers are using them, and then you're collecting the data and able to use that then for analysis. Also thinking about, how can you use that one digital tool to add use cases, add user types, add more functionality over time, knowing that like your needs of today are probably going to balloon and change and evolve over time, right? As things change. And then lastly, just really thinking about like what is going to be a long-term sustainable foundation for your program for the long haul, right? And I think when you think about those three factors, you're thinking more about long-term delivery of value. And I think it changes the cost equation too, right? Like certainly there are many free tools out there. And if really you truly have just a very short-term need, like that's great to use. But I think if you're really thinking about creating a long-term digital transformation strategy, you want to be thinking about a long-term platform and really what value you're going to see there. Okay, next question we had, and thank you, Rajesh, for popping in that question. And folks, feel free to raise your hand, come off mute if you've got follow-ups. Next question is, again, two people asked the same question, Soham as well as Preetha. And the question is, how can digital design be made sustainable in a low economic and social structure?
Yeah, that's a wonderful question too. And I think it goes back to cost is part of that, right? Which we've been talking about a little bit. But in terms of sustainability, I really think about a couple things. I think first and foremost is, does your team really feel like they have total ownership of the tool? Do they feel like they are masters of the tool? They can change the tool. They can use the tool really effectively. And not only like your current team today, but if the three managers of your project left, would there be other people in your organization who would also know the tool? That's actually probably one of the number one really like sad things I see happening is maybe an organization just has this like phenomenal comm care champion. They build a great application, runs for a few years. That person leaves the organization and then the app is still there, but the people that come in behind them really don't know what the first person did to build it. They kind of know how to run and maintain it, but not very well. And all of a sudden things start to fall apart. So I actually think the most important part of sustainability is making sure that you have a lot of experts on your team that understand how your digital system works. And I think you're going to have a few different verticals. You need to have a lot of experts who understand what does that end, like the mobile tool look like? If I were to train a new user, how would I train them? You need to have a bunch of people that really intimately understand that. You need a few people that really intimately understand how was this application built? What sort of case types were used? Why is this formed this way? What sort of features are we using in the app? How would I make a change if I wanted to make a change? How would I release a new version? So you need several people that can answer all of those questions. And then you need a whole silo of people who are data experts who understand if I want to answer the question, how many children did we give rations to in the last month? Where do I go to find that data? And where do I go to find that data quickly and easily, right? Because I don't want this to take 5 hours every month. And so I think one of the main things you can do is make sure that you have multiple people who know that. And it might not be, I mean, certainly I don't want multiple people every month pulling that one data point, right? But I want maybe there's one person whose job it is and three people who also would understand how to go and do that. I think that's the biggest challenge I've seen with the organizations is building that internal capacity within their team to have multiple people who understand all facets of the platform. Of course, like funding is a huge part of that too. So, making sure that your funding streams are there. one thing that I think happens a lot, or that I see, like maybe you have a 5-year project and you budget for phones and you like kind of never budget that they might get lost, broken, or like the life of a phone is probably not 5 years. So also looking at kind of what are the one-time costs or the recurring costs. So making sure that you're budgeting all of that and you're really forward thinking in that, just being realistic about how hardware works, how software works, things like that. I think those are really the two main things I would say, but a huge emphasis on building organizational capacity to continue to nurture, change, and grow with the tool.
Awesome. Thank you so much, Erin, for that. Kind of a related question from Monica on this, which is how can one build a flexible yet robust platform that responds to changing user needs?
Yeah, that's fantastic. I mean, half of this answer is use a digital tool, right? So it's great that you're already like in this conversation, because we know that digital tools can be, changed really on the fly and deployed quickly. I think obviously one really important thing is that your team, that you're using a self-service platform or tool. So, either, it's certainly the case that a lot of our partners work with our solutions team who have built out their application, and that's phenomenal. But then making sure that your team understands how to make changes to that app is really important, so that 6 months down the line, if something changes, you feel like you are really comfortable to go in and change that. Or you could go a totally self-service route as well. That's kind of my shtick because I'm on our self-service side. But making sure that your team really intimately understands the way that the platform works so that they can be effectively making changes quickly. I think most app changes should be informed by something in the data or something you're hearing from users. So there's kind of like this cycle. You like might release an application, you let your workers go and collect that data, deliver those services for quite a while. Maybe you hear directly from the users. That's fantastic. If your users are reaching out and giving you feedback, please listen to that. That's the best feedback you can get. Or maybe you start looking at the data and you're like, everyone's household visits are taking 45 minutes and I thought they were going to take 20. That's interesting. Let's go dive into that. And maybe you need to make changes that way. But those, I think, would be the two sources of like how you should be getting feedback, is either directly from users or seeing in the data. And then even if you see it in the data, I would still want to validate that with the user. But yeah, I think you need to be like constantly monitoring that data, constantly talking to your users, again, inculcating a culture where users do feel really comfortable like complaining. Honestly, like you want complaints. Complaints is what's going to make your project better. So making sure that people, when they're facing challenges, they feel really comfortable telling that to their supervisors, making sure that feedback loop is really strong. And then that feedback loop can be really strong, but then you as like the owner of the app have to be responsive, right? It's not to say that you should make every single change that someone gives feedback on. In fact, I think you want to think really critically about the feedback. And sometimes people tell us the solution when really what we want to know is the problem. And then you need to figure out the solution from that problem. So you might need to dig in there a little bit. But I think if you are getting really valid feedback and your folks are having a tough time, then, being able to have a team that can go in and make changes to the app pretty rapidly and also with a lot of care and detail is key to making sure that, users understand, oh, I gave feedback and like 2 weeks later, they actually changed the app. That's fantastic. One other thing that I will caveat, because I've seen this a lot too, is it is amazing how quickly you can make and deploy application changes. And if you are deploying changes every day, you're going to run into issues as well. So there's kind of this trap that we fall into, and I fully put myself in the middle of this trap as well, where you're getting user feedback, and especially if it's like a bug, you're like, oh my God, I want to fix that immediately. But if you are just rolling out change after change after change after change, there's a really good chance that your users are not all on the correct updated app version. And depending on what the change is, that may or may not have like really disastrous effects for your data. So one thing that I'll counsel organizations on a lot is setting up sort of a schedule for when they would do app releases. So maybe early on in the program where you expect a lot of feedback, say every 2 weeks, we're going to release a new version and it's always going to come on a Friday. So all my workers know, they need to go in on Friday and update their application. And then from a communications perspective, on that Friday, after you release the app, send a WhatsApp message, send a text message, call your folks, tell them to update the app. Go into your reports, make sure that they did update the app. So there's actually there's a longer tail. If you're really updating the application and that's getting out there, that's actually if you're doing it right, it's a longer process than I think we all like to think it is. Because we're like, oh, click, gets released. But you really need to follow up with that. So I would say putting it on a schedule is a really great idea, unless it's like a show-stopping bug. If it's a show-stopping bug and people can't do work, fix it immediately, release it immediately, tell everyone immediately to update. But yeah, so I think being nimble in all those ways is a really great way to show your users that you're responding to them, and also be able to change things based on user feedback or changing needs in the field as well.
Yeah. And I think just to add to what Erin's saying, I think, Erin, you're speaking to if someone's using CommCare, but I think it's also an additional consideration to think about as you're choosing your digital technology platforms is this tool able to accommodate changes over time based on user feedback or based on changing needs? So really important thing to look at.
If you have contracted with some big company to build you a custom tool, that's great. But every time you need to make a change, you're going to have to go back to that company, probably pay them, and then also have them make the change. So that's a really big consideration, because I know we'll talk to lots of folks that are coming from custom tools to something that's not custom, because they say, we just the custom tool was great until it wasn't, and we need to have ownership over it. So I totally agree. I mean, that's a really big consideration for when you're choosing the tool.
Yeah. Yeah. Awesome. Looks like we've got a question from Tsagaye in the chat, which is, how can CommCare help in monitoring or following up on a single user to see if they participated in different interventions for more than a single year?
Yeah, it's a great question. So if you guys, for those of you who are kind of already in the CommCare world, you'll understand what I say when I mean what I mean when I say case management. So case management is kind of one of the most exciting features of CommCare, and it's the ability to follow up with an entity, whether it's person or farm or bee box, over time. And so using case management is going to be the way that you can track the same person as they do different things and as they are part of different interventions. We are seeing increasingly a lot of organizations who, might have kind of one central registry, but then a lot of different interventions. Sometimes it's like health and psychosocial and education, or sometimes it's I see Haley on the line from MHP Salute, they do a lot of different community health programs. And it might be the case that, someone is enrolled in multiple of their programs at a time. So one of the cool things, and actually Rachel and Haley from MHP have done this, is they have a central registry, and then you register people separately for each intervention. But what that means is on the back end, you can go and look at their data, and you can see the different programs that they're also a part of. The one great thing is that it allows you to not double count that person, right? Because if you're signing up for 4 programs, we don't actually want to report out on you as 4 different people. We want to know that you were involved in 4 programs, but you can't have 4 Erin Quinns. Otherwise your funders are going to get pretty upset pretty quickly that you're kind of overinflating your data and your number of beneficiaries. But yeah, I think that's how you do it, is you link things up using case management, and that allows you to report out on both the discrete deduplicated number of beneficiaries you serve and the number of beneficiaries you serve in every single program. And I think both of those numbers are important.
Looks like, Tsagaye, do you want to speak to your follow-up question there?
Hello.
Hello.
How are you?
Welcome.
It's a guy from. I have tried to elaborate what I'm trying to link participants, which is more than 500,000 within a project areas. But these hundreds and thousands of participants are benefited a lot of interventions. This intervention is maybe for a longer period of time, that is more than 3 and 4 years. A single beneficiary, a single participant is benefited in more than 5 and 6 interventions. Then we have to follow up which participant is benefited from which intervention. And even we tried to identify those participants which are not overlooked, which are not double counted, and so on. And I have tried to manage this with tools that are tried in case management by reading the help from CommCare. But I haven't tried to manage it yet. I like to know more on this issue. Thank you very much, Erin and Amy. Thank you.
Sure. Yeah, it's a great question. And it's a little bit of a complex way that you set this up. So don't feel bad that you haven't figured it out on your own. Basically what you're going to need to make this work is you need some sort of central registration form. So no matter how the person comes in and what their initial intervention is, you need some standard registration form for every single program. That will register the person as kind of their person case. And then what you can do, there's kind of two options. You can either just continue to, like, maybe in your registration form, you ask what interventions are you taking part in? And you can actually, with the checkbox question, tick those off. And then using case properties, you can filter those out and you can say like, okay, you're part of the health intervention. Then we bump you down and in a different module, like you now appear because you're part of the health intervention. And then you can edit that person's interventions at any time. So you can say like, oh, now this person wants to join this other intervention. What this means is that you need to enable case sharing. So all your users from all the interventions need to case share that person case, because they all need to have access to every single person to be able to add them to their interventions or not. There's a lot of really cool things you can do with module and form filtering, and display conditions to make sure that, if I'm the health person, even though I'm case sharing everyone's cases, I'm not actually seeing data for folks who aren't in the health program. Like if you're only in the education intervention, those folks won't actually show up on my device. It's important, obviously, to make sure that, we're not just showing people data for the sake of showing them data, trying to keep folks' like privacy and confidentiality intact. But yeah, so that's basically, you need to case share that main person case. And then you can either use case properties or child cases to do the individual intervention work. And then that individual intervention work, I think you want to be aggressively using either case list filtering or form display conditions to make sure that the staff who are part of those interventions are only seeing a subset of people and a subset of those forms specific to their interventions.
Awesome. Thank you. So the next question is really around integrating data from different digital health systems. So we all know that data doesn't exist in just one beautiful, simple, clean platform. There's multiple places where it exists. So we had a question from Maya Bangwe, which is, what are some best practices and methodologies in integrating data from different digital health systems in order to centralize data usage?
Yeah, that's a fantastic question. I think we do see some best practices. Like one I would say is to really think holistically about the system and not overuse too many tools. I can't tell you how nuts it drives me when I see like 5 different data collection tools that are all feeding into like the same SQL database or a DHIS2 instance, and none of them are doing it automatically. They're all having to do it manually. So one is really looking at that system holistically and saying like, what are the systems I'm interacting with at each level? Like what's my frontline sort of like collection level, what's my like aggregator level, and then like what's my analysis level. And sometimes like if you're working with a government, oftentimes you as the implementer might not have the choice there. They might say like, you have to report into our DHIS2 system, and that's fine. And then you need to go choose a tool at that like kind of collection level that will both serve your frontline workers' needs and also be able to easily integrate with DHIS2 or whatever that system is. I'm saying DHIS2 because I think that's the one that we are hearing the most for our health systems. So I think, yeah, the first step is understanding what is the full system, what is in my control, what is not in my control. So like, is the government going to define part of this for me? And then based on the things that I can't control, what can I control and what's going to fit best within that? And this is where like conversations around interoperability are super important. So how like can the tool I've chosen, can it integrate with that? What does that integration look like? How hard is it to set up? Like how often does it refresh? And then, a lot of times too, I will say like you might be part of a consortium, and that whole consortium is, beholden to report up into like a main government system. And so insofar as you can work with your partners, your potentially even your competitors, to just kind of collaborate really well, see if there's a way you can all be using the same tool. I think like if you can lessen the number of tools that are used, that like necessarily means that the final sending of that data to a main system is going to be a little bit easier and a little bit cleaner. But it's a really tough thing. I don't think anyone has solved this issue yet. I think that's one of the main things that all of us are trying to do well now.
Thanks for that, Erin. And feel free to, folks have follow-up questions on that, feel free to raise your hand. I am going to go to the next question we had pre-asked, and this came actually from 3 different folks, which is really around case management. So, Erin, you've spoken a little bit about case management already, but the questions are, how can we best digitalize the case management system? And then specifically, how does case management in CommCare work?
Absolutely. And I'm so glad that you guys asked this question, because I really hope that almost anyone who's using CommCare is using our case management functionality. So as we talked about before, case management is just a fancy way of saying tracking something over time. Oftentimes what we are tracking is a human. It might be a mother, a child, a farmer, a collection of people. It could be a household. It could be things like water pumps or plots of land, or like I said, bee boxes. One of my first projects in India was monitoring the health of bee boxes. So think flexibly, first of all, about what your cases are. But basically then what you want to do is think a lot about the workflow of this. A lot of times we'll start off in a project and folks will be like, these are the 10 forms that I have. And they're like survey forms. And I say this with love, because I also come from a monitoring and evaluation background, but it was clearly made by someone on an M&E team that didn't think about how we were collecting this data and who's going to get asked it. And so sometimes one of the first things I do is I take those 10 forms and I say, all right, but when are we asking this and who are we asking it to? And you really need to think about case management from that workflow perspective. When is the first time I'm going to register or open this case? Okay, this is the time. What can I ask in that first visit? Okay, these are the things I can ask. And it might be that you're kind of slicing and dicing these different forms in your application in order to make this workflow make sense. And then, once you've kind of got that workflow, once you've sliced and diced and figured out who is doing what, where, and when, and you've kind of built that all into your application, the other thing you can do is really think about what are the ways in which I can creatively use case management? So if I asked you in your registration form when your date of birth is, and I have a follow-up module that's only for babies in an app that follows up with mothers and children, I can really easily filter out any kid that's over the age of 5, or any human that's over the age of 5. So there's lots of, by using case management, by referring to that date of birth I've already collected. So there's lots of really interesting ways that you can make sure that your data stays clean, that your app stays really usable by referring to things that you've already collected. And I think if you're really utilizing the benefit of case management, you are referring to lots of those things within the app. It can even be as simple as, if I'm following up with a child for a growth monitoring visit, I can say at the beginning of my form, I can say, you're following up with Seamus. Your last visit with him was on July 31st. On July 31st, his MUAC was whatever, and we referred him to this. You can kind of even put a little summary up there, whatever you can do to really, again, focus on making your frontline workers' jobs easier, making them better at doing their jobs, and then of course, delivering better services to their beneficiaries. And I think if you're using case management effectively, and it means thinking a little bit further than just what is my data, but it means putting yourself in the shoes of a frontline worker and saying, okay, I'm going up to a random house, what would be helpful for me to see today? And then thinking about it, and then thinking about how case management can enable that.
Awesome. Thank you, Erin. And Yahaya, I see your question. We're going to come back to that in the last 10 minutes or so. And feel free to keep adding questions. So, Erin, next question is, what are some of the most common mistakes, and what does failure look like beyond the obvious quantitative one where you didn't meet your target KPIs?
Yeah. Oh gosh, there are so many. I'll talk about the ones mostly that I see from the way that I see technology failing. And there are lots of different flavors of this as well. I think one of the ways that we see technology failing is, and I see it less now. I saw it a little bit more 10 years ago when I started working at Dimagi, and tech was really new and really fresh. And so people just wanted to add it into their project to say they had this mobile tool, and they weren't really thinking through what that mobile tool was doing. So one, I'll say that, technology does not always add value. It only adds value if you are investing in making good choices with your digital tool. So the number one mistake, or not the number one, but one big mistake I see people doing is just adding tech for the sake of adding tech and not really thinking through, why are we using it? What is it enabling? How is it going to help us? because if you're just adding tech to add tech, and then you've got, 500 frontline workers all using this app that they don't really like, that isn't really helping them, you've done nothing. In fact, maybe you've actually hurt your project, because now they're wasting their time with this digital tool that's not making their life better and not making the services you deliver better. So that's one thing, is just like adding tech for the sake of tech, which we should never be doing. And also, by the way, gives like technology a bad name. I also think like technology will amplify whatever your project is doing. And so if your project is currently failing and you like think adding tech is going to be the solution, you need to think holistically about like how that's going to improve your project. And a lot of times it does, but if you just add tech on top of something that's not working well, it's also going, like, the tech is just going to amplify how bad that's working. So just like thinking about those things, I think is a big pitfall we see. The other one that I talked about a little bit already is just like not having that institutional knowledge of the tool, and having, and in tech we call it the bus count, like how many people would have to get hit by a bus before no one knows what this tool is doing. So if you only have one or two CommCare champions that understand what your application is doing, that's a huge threat to your project, because if those people leave, are kind of stuck. And this happens a lot. We know that there's a lot like high turnover rates of staff, particularly, in local places, and no one's going to stay with an organization for forever. So we need to plan, to one, have a lot of staff people who fundamentally understand and can operate the system, but two, also have a really robust set of like documentation, whether it's video or written, so that maybe if so you didn't have any other staff that understood it, but you hired someone new and you're like, oh, well, here's the amazing set of written documentation that will teach you exactly what our system does. So I think like failure can definitely be that organizational sort of capacity building. And then lastly, and this is the failing that is the saddest to me, is you build an app, it's fantastic, your users love it, it's fantastic, and no one's looking at the data, and that's not fantastic. So you can build the perfect app. And this is really where like I, as a practitioner, feel like my hands are tied, because I can give you the perfect app, but I can't make you use it in all the right ways, right? And that's really sad. And so I think the way that I see these failings come out is either, like we were talking about, you're not looking at that data on a frequent enough basis. Like maybe you have quarterly reporting. So say at the end of September, you look back at your data and you're like, oh my gosh, no one was doing work in July. Well, it's September now. So for 3 months, we just let this problem fester and no one did anything about it. That's really sad. That's a huge missed opportunity. That was not the technology's fault, but it was like the people not consuming the data's fault for not catching it earlier. And also, I think, so there's a whole bit there about like, are you using the data effectively? But then also, like, are you collecting too much data? It's real time, it's real effort, it's real energy to collect data, consume data, analyze data. So another trend we've seen recently is organizations saying like, we don't need 2,000 global indicators. We can pare this down. If you have an indicator that's being collected that is not actually telling you something, that is not informing the way that you think about your project or the way that you think about the success of it, you should probably not be collecting it. And that might be tough, because it might be your funder that's telling you to collect it. And I'm not saying that's an easy conversation to have, to go back to your funder and say, hey, this is a really meaningless indicator and we don't want to collect it. But I think failure can look like that too, either collecting data for the sake of collecting data that is maybe not useful, or just not using that data. And a lot of times when we see not using the data, it's not that we're not using the data, it's just that we're using like a quarter of the data. So if you're only using a quarter of the data, probably don't need those other 3/4. So I think that's a much more like nuanced failure, where it's a success and a failure put together, but I think it sums out to a failure. And it's very sad to see as well, especially if your tech team has invested a lot of time and effort and energy into creating a great tool.
Yeah, thank you. Thank you so much for that, Erin. And if I had to kind of reflect on some of your answers there, like I think about technology as one piece of the puzzle, right? And then you've got the people and the processes, and you kind of need to be thinking about all three. And I feel like you've nicely highlighted on some of the ways that each of those three things can fail, right? Tech can fail when you're not actually focused on creating better jobs for your users and you're just doing tech for the sake of tech. The people stuff can fail if you're not actually thinking about how do you build capacity sustainably over time in your organization and document what you're doing so people can take it forward. And then the processes can fail when you actually just don't have a system in place to be looking at that data and actually making different decisions based on what you're seeing, from all this great data that you're collecting. So that's, yeah, really beautiful response.
If
We've got,
you've ever been in a recording with me, you might have heard me say the tech is the easy part. Like the app building is not the hard part. It's like supporting it with all those other things and making sure that the tech actually, can deliver its promise.
yeah, absolutely. And I think that's an important thing we want to be like able to talk about in these conversations too, because there's so much to it. So quick time check. We've got about 10 minutes left. We're going to ask a few more questions, get a few more meaty answers from Erin. But while I'm speaking, we're also going to put up a short poll. I've gotten messages from a few of you with an interest in just being alerted of the next ones and how can I get in touch with the team. So it's just a super short poll to understand, how the session has been for you. If you want to follow up with our team, what additional questions you have. So please take a moment to fill that out. And with that, I'm going to move us to the next question, which is, how can I design interventions for impact and scale? What lessons and experiences can be adapted for resilience programs? This is from Charles.
Yeah, that's a great question. So, okay, how can you design for impact and scale? Let's start with impact. So this goes back to kind of what Amy was talking about, looking at our impact delivery framework, looking at creating better, more, and sustained impact over time. You're going to start by really needing to understand your users, understand what they want out of a tool, what their current pain points are, what could make those pain points better. And that's really where you're going to want to start is at that frontline worker. So if you can really understand those challenges, those problems, then you're going to be able to design a tool that can help fix those. As you fix those, you can go up the line. Then of course you can't fix everything on the front line and have, the middle and HQ part broken. But I think if you start there, that's a really great place to understand how you can deliver better services and create better impact. So that's what you want to do at the frontline worker part. And then I think a lot of the things that we've spoken about already, kind of making sure that there's a really robust supervisory structure. So, a lot of times I've seen kind of this 10-to-1 ratio of frontline workers to like a field level supervisor, to make sure that they always have someone that they can reach out to, so that there's a supervisor that kind of like has to know what's happening with their 10 people every week. So, making sure that you have those field level supervisory structures is super important to make sure that, these problems aren't festering for 3 months. I've seen personally folks who, maybe will look at their monthly report and we're like, hey, you haven't done anything. And we'll call them and be like, hey, what's going on? And literally someone's like, oh, my house burned down a month ago and my phone was in it, so I don't have my phone. And we were like, so were you gonna tell us? And, it's obviously very tragic, and I can understand when your house burns down, like replacing your mobile phone is not like the priority. But, I think having that supervisory structure there to make sure that there's like this really quick communication chain, so that we would have found out about that within a week instead of a month, is very important. And then making sure that, you have people kind of one level above that field level supervision, kind of at that lower country level, maybe like a district level, that are really intimately looking at the data, picking up any trends that are changing, and then escalating that to kind of country office level if there is something of that sort that they want to be looking at. And then just, making sure that, when there are trends that we're picking up at that lower, like local or district level, and we're reporting it to country office, that they actually can make changes. Obviously, depending, funding in the development industry is really tough. A lot of times our hands are tied of what we are and are not allowed to change. But I've seen a lot of funders be very responsive to us saying, like, this is what the data is showing, and there's clearly a different need. Can we reallocate? Can we do something different? If you can really prove it with data, I would say a lot of times that really resonates with folks. So I think that's what you can do for impact. For scale, like one of the most important things is, and then if you've ever done an application design call with me, you know this too. I'll say, like, what do you want this app to do? And I want you to tell me everything you want it to do in like the next 5 years. And we might not build it out, but we need to think about it from day one for that eventual state. So making sure that you're planning for the eventual scale and the eventual state, even on day one. A lot of times we will get folks coming over from other digital tools because those tools cannot operate at scale. So one of the things we talk a lot about with ComCare is, like, it's very easy to use for small scale interventions, and it can scale. It's a national scale interventions. So making sure that you're choosing the right tool and you're building correctly to accommodate the future scale that you anticipate is really important. And a lot of times on day one, people don't want to talk about 5 years from now, but I try to force them to, because otherwise what you end up doing is building something that's temporary and then having to totally rework it. And that is really painful as well. And you can lose a lot of good faith from your users if you're, constantly changing things every few years.
Thank you for that, Erin. It looks like we've got a great question from Alexandru in the chat, which is how accessible is the data that we collect with the apps? And does Dimagi offer trainings for a major comprehension of how to use the tools at their best?
Yeah. So what we try to do in terms of like kind of our philosophy here is that we want to make sure that there are ways that you can take our data out of the system, no matter what sort of data literacy you have or what sort of analysis you want to run. So like you can download something from CompCare and just take it into Excel. A lot of people are really comfortable in Excel, and that's correct for them. You can also link it up to like Power BI or Tableau and do something a little bit more fancy. You could use your APIs or a data export tool, put it into a SQL database, do some really fancy things with it. So I think the data, I mean, we endeavor to make the data as accessible as possible. You could also even build custom reports natively within CompCare for folks who you didn't want to even have to take it to the Excel. And, of course, we also talk about creating like Excel dashboards or Power BI or Tableau dashboards, because maybe there's a lot of folks on your team who want to see the data, but they don't quite know how to analyze it. So can you, as that steward of CompCare, create those reports that other folks can consume? So we hope it's accessible, and it should be. I mean, the point of all mobile data collection applications is to get data out of the system. So, I mean, I can speak about CompCare, but other tools should be doing this as well. And I do think, though, one thing you want to look at is what is my need, and understand that different users within the system will have different needs. Like for someone, Excel will be the most advanced tool they can use, and you need to be able to give that person a way to understand data within Excel. And for other people, they will be running like t-tests and regressions, and they need to be able to do that too. And so you need a tool that's going to be able to like easily get the data to all those places for those users. And then, yeah, we have trainings. We have a really robust help site on our online where you can find this. My team offers trainings, our solutions teams offers trainings. So definitely reach out to us, and we're happy to tell you kind of about what we have in terms of our onboardings and other advisory services.
Awesome. Alexander, does that answer your question? Is there any follow-up you want to have?
Yes, it's for now it's okay. We will contact you and we'll come back with some more questions. For now, it's okay. Thanks. Thank you both.
Okay. Awesome. So want to give a final reminder to, if you haven't already filled out the poll, that would be really helpful to give us a sense of, is this a useful format? This is our first time doing kind of a live session like this. So definitely want to hear your feedback. And also if folks want to have follow-ups with folks on our team, that's a great way to let us know, and we will follow up with you. So I think what I'm going to do is I'm going to close this out, but I will say if folks want to stay on and you've got burning questions that we didn't get to, I think, Erin, are you okay to stay on for another like 10 minutes or so? Yeah, I think we can kind of end the formal session, but feel free to stick around. So thank you so much to everybody for joining. This has been really fantastic. I've loved hearing questions and seeing some of your faces, and hopefully we'll be doing more of these in the future. So if your questions didn't get answered, we'll do additional sessions, and there's other ways to follow up with us. So thank you so much. And thank you, Erin, for all of your thoughtful answers.
Yeah, thank you guys so much for joining, and thanks for these amazing questions. We weren't really sure the sorts of questions we get, and these were probably better than I ever could have imagined. So great job.